Accurate measure for crutches vital to prevent brachial plexus injury. Distance between Achilles and arm pieces is 2 to 3 finger widths. Elbows is slightly flexed 20 to 30 degrees when walking. Never rest axilla on axillary bars. Place crutches 6 to 10 inches diagonally in front of the foot.
Flex elbow 20 to 30 degrees angle and hold handle. Tip should have concentric rings, a shock absorber, and to provide optimal stability. Tip of cane should be 6 inches lateral to the base of the fifth toe. Measuring prescription. Place the walker 12 inches in front of the patient. The walker should partially surround the patient. Measure the proper height of the walker by having the patient stand upright with the elbows flexed 20 degrees.
Good day everyone! I'm Maureen Igana and Jeremy Matilla, and we're going to teach you the appropriate use of assistive devices. Crutches. The crutch is made of the auxiliary bar, the hand grip, the double upright, the single upright, the adjustable button, and the rubber tip. The walker. The hand grip, the adjustable button, and the rubber tip. The cane. The hand grip, the adjustable button, the single upright, and the rubber tip.
Wash hands before and after the procedure to avoid spread of infections and to avoid contamination. Gather all the equipments before the procedure to conserve time, energy, and effort. Establish rapport. Introduce yourself and identify the patient. Explain the procedure. Vital sign the patient to know her condition. Introduce the equipments to be used. After introducing, measure all the equipments of the patient to her appropriate height. The crutches, the cane, and the walker. After measuring all the equipments, transfer the patient from bed to wheelchair. It is always important to ask for the patient's body weakness. In my case, the body weakness of the patient is the left side. Before transferring, move the patient first at the edge of the bed. Always remember, never push the patient but rather pull. After moving the patient, it is now time to sit the patient down on the bed. Ask the patient if she is feeling dizzy and ask her to dangle her feet. Demonstrate the procedure to the patient first. Move the right crutch, move the left foot, move the left crutch, and move the right foot. Continue the sequence. In all the procedure, always remember to turn the patient at the nurse's side for their safety and security. Move both crutches and affected leg forward and move the unaffected leg forward, and continue the sequence. Advance the right foot and the left crutch simultaneously. Advance the left foot and the right crutch simultaneously, and continue the crutch foot sequence. Swing to gait. Move both crutches forward, left, and swing the body to the crutches. Swing through gait. Move both crutches forward, left, and swing the body past the crutches. In sitting down the patient, make sure that the wheelchair is locked and the back of the knee must touch the edge of the chair, and the strong side must hold onto the armrest for better security and safety. Put crutches on the first step. Put weight on the crutch handle and transfer an affected extremity to the step where crutches are placed. Repeat until the client understands the procedure. Put weight on the crutch handle and lift the unaffected extremity on the first step of the stairs. Put weight on the unaffected extremity and lift other extremity and the crutches to the step. Repeat until the client understands the procedure. Advance cane on affected leg. Lean on cane when moving good leg. In sitting down the patient, make sure that the wheelchair is locked. The knee must touch the edge of the chair, and the strong side must hold onto the armrest for better security and safety of the patient. Advance the cane and the affected leg and the unaffected leg. Repeat until the client understands the procedure. When going up the stair, move the cane and the unaffected leg and the affected leg. Repeat until the client understands the procedure. With partial or non-weight bearing, put weight on wrist and arms and step forward with affected leg, supporting self on arms and follow the good leg. In turning the patient, always make sure that the patient turns at the nurse's side for better security and safety. Move walker and swing both lower limbs. Continue until the client understands the procedure. Move walker and drag both lower limbs. Repeat until the client understands the procedure. In sitting down the patient, Make sure that the wheelchair is locked. The knee must touch the edge of the wheelchair, and the strong side must hold onto the armrest for better security and safety.